We are geared towards alleviating pain and suffering of any person whenever they are, anytime. Your Excellency, Mr. President, St. John Ambulance Kenya runs a successful network of 34,000 volunteers groups across the country, with boys and girls, men and women who have dedicated their lives all through their young age, through teenage and adulthood, serving St. John ambulances as volunteers. They are learners from the age of 6 in primary schools, whom we refer to as dolphins. Another group from the age of 12 to 18 is in secondary schools. We call them cadets. And 18 to 35 we refer to as links. Mostly students in colleges and universities, and adult category who are members of society. Persons you live with next door, but fully trained to save lives in emergency cases. Your Excellency, sir, the government has been our main partner in all our activities. From a long-standing relationship with the Ministry of Health to the Ministry of Transport and the Ministry of the Interior, we are running various volunteer activities with their support and coordination. Whenever there is a disaster, such as collapsed buildings, these volunteers come in handy and offer emergency rescue, first aid care and site evacuation through our ambulances. These services, Your Excellency, are all done for free. All our volunteer programs are based on community health care. Adult volunteer groups in the community, for instance, are always on call whenever an incident occurs within their jurisdiction. This means if a call comes through to our emergency number at the headquarters, we call these adult volunteers in the community where the incident occurs and dispatch them to respond faster, even before ambulances and other agents get to the scene. By doing this, Your Excellency, we reduce cases of pain, suffering, and death that may occur due to lack of emergency care during the critical time of an emergency. Last year, we entered into a partnership with the Ministry of Transport through NTSA to train and equip some 200,000 border riders across the country, teaching them first aid and emergency response. We are pleased to report that close to 2022, we already trained 200 border riders in Nairobi. We are looking forward to proceeding with the training for the rest of the riders in Nairobi and other parts of the country too. In addition, the government supported the purchase of 6 advanced life support ambulances, some of which, Your Excellency, you have seen a few moments ago, for St. John Ambulance. This happened through the Sports, Arts and Social Fund that is not only ensuring that our communities receive emergency care at the right time of an emergency, but also well prepared to handle disaster should they occur. This is in line with your government's mission to ensure that Kenya has enough well-trained community health volunteers within our estates, villages, and towns. St. John Ambulance reiterates its support in this government initiative by availing all our community health volunteers for this. Your Excellency, may the Lord bless our country, and Your Excellency, may the Lord bless St. John Ambulance. Your Excellency, it now gives me much pleasure to invite the Cabinet Secretary for Health to make a few remarks.
Your Excellency, Mr. President, William Samoei Ruto, the Chair of the Council of St. John Ambulance, my two PSs present here, the Council members of St. John Ambulance, government officials present, and the whole community of St. John Ambulance, good morning. Your Excellency, it gives me pleasure that this morning you found time to graciously inspect the 93rd parade of St. John Ambulance. The council visited me in the office, and we discussed and agreed that we make time and organize for you to inspect the parade, which we are indeed very happy that you made it today. Your Excellency, St. John Ambulance plays a critical role in the health of this. As it has been elaborated by the chair of the council, they provide emergency services. And that is what makes a difference between when an accident occurs and when the patient is restored. So I'm indeed happy to report to you that since we came into government, we have been working very closely together. And Your Excellency, we now have a tripartite memorandum of understanding between the St. John Ambulance, the Kenya Medical Training College, and the Ministry of Health, where they are working together to train a number of St. John Ambulance people to be able to carry out their practice as first responders. Your Excellency, besides the community health promoters that we are going to launch in the next few days, St. John Ambulance has trained over 40,000 first aid responders. And this will form an army together with our community health promoters to work within the communities in our bottom-up economic transformation agenda to ensure that they promote health and that we move away from the curative services that we have been focusing for many years. So I want to ask of the St. John Ambulance community that we work together to ensure that we promote health, equally prevent disease from happening. So I'm very happy, and especially with the council, where we've had discussions. And Your Excellency, when they came, they made two major requests. One is to get their allocation, which you indeed directed, and they received 100 million from us. And the council has acknowledged that they have put it into good use. It's one of those that they used to buy the ambulances. Your Excellency, you also directed that from their request of being moved away from the city as their headquarters, you directed me, and I'm in touch with my colleague from the Ministry of Lands, and you did direct that they be allocated 1 acre of land in Upper Hill, which I did communicate to them. So indeed, Your Excellency, we are working very well together. And you now, as the chief patron, I believe that we shall continue to work together to promote health and prevent diseases. With those few remarks, I would like now for all of us to be upstanding so that we invite His Excellency the President to make his remarks. Asanteni sana.
Thank you very much, Waziri. Good morning, everybody. Habari zenu? Okay, you can take your seats. Thank you very much. The Chair, Paul Ndungu of St. John's, and all the other leaders, St. John community. I'm told there are dolphins, and then there are cadets, and then we have links, right? All those categories, I want to welcome all of you to this very important morning parade. Congratulations to all of you for what I see as a great movement, and it is my pleasure to join you for this year's annual parade and inspection. This occasion is a commemoration of St. John's Day, a celebration of the milestones and achievements of this organization, and a chance for all of us, including me, to rededicate ourselves to the values and goals of St. John Ambulance in Kenya. Today I commemorate this day with you, an honor that I accept with humility and respond to you with a genuine eagerness to support you and to strengthen emergency and pre-hospital care in Kenya through the individual and collective contribution of this great St. John's Army that I see. The cultural consensus amongst most opinion shapers in Kenya today is that there is a lot of individualism, there is a lot of selfishness out there, and that most people are looking out just for themselves, and that the values of selflessness and service to others has become very remote. The existence of the St. John's Ambulance and over 26,000 volunteers breathes some fresh air to us as a nation, that there are indeed people out there who want to look out for others, for the good of others. I want to say to all of you, congratulations for being part of that team. We were told, we attended the prayer breakfast the other day, and we were told, if you can feel pain, you are alive. But if you can feel the pain of others, then you are a human being. And I think St. John's embodies those who feel for the pain of others, and they step forward to do something about it, to help in situations that are of an emergency nature, situations that otherwise could lead into loss of life. And I want to say to all of you, congratulations. You have our support as you bring up the children, the younger ones from age 6 to, the dolphin are 6 to 12, right? And I see many of them here. That is very good training. Emergency and pre-hospital care is an integral component of quality health care services. We are committed to, as expressly expressed in our agenda and articulated by Minister here, to the provision of quality, affordable health care and the achievement of universal health coverage in Kenya. And that is why preventive and promotive health care is important to us. It is very important that we work towards eliminating instances where people are hospitalized. We are presently developing strategies and policies to guide implementation of emergency and pre-hospital care. As the Minister has told you, we are in the process of formalizing the engagement of 100,000 community health promoters in Kenya, working between the national government and the county governments so that we can begin to respond to matters health at the earliest possible age in every village, in every town, and in every part of the Republic of Kenya, because we all agree that sometimes hospitalization becomes very expensive. Many people, it gets out of the reach of many people, and therefore we have to rethink, re-engineer, rework our plan, our strategy on how to deliver health. And I see the participation of St. John ambulance volunteers in working with our community health promoters. And I am happy that I have been told that it is the vision of St. John to make sure that in every family there is at least one person who understands something about emergency and emergency help. We will work with you to make sure that your vision becomes a reality. At the same time, we are developing a comprehensive architecture for health financing, including emergency medical fund to enhance access to emergency medical care for Kenyans, irrespective of their social status. I applaud St. John for the leadership and commitment to supplement government efforts in provision of emergency and pre-hospital medical service to Kenyans during emergencies and disaster, including when we had COVID-19 pandemic. Your gallant services have saved thousands of lives, and I thank you on behalf of very many grateful people who are beneficiaries of the services offered by St. John. I am also pleased to hear that we share a belief in empowerment from the grassroots. I am pleased to learn that your target to ensure every household in Kenya has an individual who is trained in first aid across the country becomes a reality. This is actually bottom-up in full effect. I acknowledge your contribution to both the emergency medical care policy and the emergency medical care strategy. Your input in making sure that we have a policy framework that ensures that the country is seized with the matter of emergency medical care is a huge contribution that you have made. We intend to build on it as we work on a new legislative framework and policy framework that we are currently developing that is going to take us to enacting 5 different laws, I think, maybe 6. We are working with the county governments so that we can deliver not just on health in general, but also emergency and pre-hospital medical service to the people of Kenya whenever they need it. The St. John ambulance has made strides in strengthening emergency response through community approach. We are taking the same approach in our quest to transform healthcare through a focus on preventive care. We believe community-level management of minor ailments will free up crucial health resources and promote health living. Through government funding, St. John has made significant progress, acquired 6 advanced life support ambulances, which I have witnessed this morning, and established 2 trauma clinics in Emali and Kinungi, purchased training equipment and trained 10,100 first aid responders, including border riders, community volunteers, residents of informal settlements, individuals in proximity to black spots and other high-risk areas. Immediately after this meeting, I will be having a meeting with our border riders, and I will remind them that I was with you and that I have heard the chairman here say that you want to complete the training of the remaining border riders, and we will see, working with the Ministry of Transport, how we can make sure that that becomes a reality, and we ensure that we equip our border people with skills on emergency medical care and support, so that they can become part of the big network that you have built of people who have the skills to attend to Kenyans whenever they are in emergency situations. I am pleased to announce that in continuation of this partnership with government and in response to your request, the government of Kenya is going to allocate 1 acre of land so that you can relocate from your current premise. And I urge Kenyans of goodwill, partners of goodwill from both local and international, to work with the St. John's for them to be able to put up a building befitting the sacrifice and contribution that is being made by St. John. As patron, he is the patron, right? I am the chief patron, but who is the patron? Oh, the patron is, oh yeah, the patron is my former boss. Masden Madoka, I used to work under him when I was an assistant minister. I can vouch that he's a very good man, and no wonder St. John's is going places. Thank you very much, Mr. Patron. And we will work together to make sure that St. John's is on a very sound footing, so that you can continue to do the good that you're doing. Training these young people, the young people of Kenya, to be volunteers, to know that you don't have to be great to help. You don't have to give. Volunteering means you can be gracious, you can be magnanimous with what you have. If it is skills, if it is something you can do for a fellow human being, in especially an emergency situation, it is something that you can offer. So continue to do that for the people of Kenya and to all people in need. Road accidents are the most common emergency situations in our country. I acknowledge the contribution of St. John Ambulance towards the provision of quality emergency care services on our highways through 17 rescue centers spread out across Kenya. I ask the Ministry of Health, Transport, and county governments to grow and enhance their collaboration with St. John Ambulance to ensure seamless provision of emergency, pre-hospital, and ambulance services to all Kenyans. I commend the entire St. John family for what you have achieved over the last 1 year. I also applaud you and all the volunteers for your patriotism and humanity. And you have just been outstanding. In fact, many people, myself included, always believed that St. John's is a religious organization. Until I got to know that it was not a religious organization, that it is an organization that serves humanity because they believe in humanity and they believe in volunteering to serve fellow human beings. And that's the teaching of all our religions, that it's good to serve your fellow human beings. So Mr. Patron and your team, let me encourage you, whatever it is that we will need to do on the part of the government of Kenya, you will tell us so that Minister here and her team can work towards making sure that we support you so that you can continue to do the good work that you are doing, especially with our children. The teaching of these young Kenyans to be volunteers, to serve humanity, to give what they have to fellow human beings is the biggest thing we can do to these young Kenyans, to inculcate in them the spirit of giving, the spirit of volunteerism, the spirit of patriotism that makes them greater human beings. We will see how we are going to involve St. John's in all the other aspects as we work. I want to encourage Minister and her team as we deploy the whole full range of universal health care network across Kenya. Let us see how we can leverage on the big network and ecosystem that has been built by St. John, involving especially the young children of Kenya in making sure that we live in healthy communities, that emergency medical care also extends to prevention. How do we prevent accidents from happening? How do we prevent people from getting into situations of emergency? How do we work on our delivery of health care in a manner that we can avoid situations that lead into emergencies? How do we make sure that, as we have planned with our community health promoters, we have planned that there will be one community health promoter for every 100 households. I think St. John's are giving us even a better template. They are telling us there should be at least one member of every household that has skills and understanding on emergency aid. I think that is something we can pick and we can run with it and we can ask for the support of St. John. So asanteni sana. To the young people who are part of this great army, I want to promise you that you are doing a great job by being part of the St. John ambulance movement. Pongezi sana. You have my support 100%, and the government of Kenya is going to work with you. We will see how we will continuously support St. John, Bwana Patron. You have access to me. You can give me instructions. You know you can do that. So you can tell me what it is that you want us to do so that we can mobilize government resources, government leverage to assist you do this great job that you're doing with the young people of Kenya. So you can count on me. CS Susan will be in touch with you so that we can see what additionally we can do to you and to the whole organization to make it fit for purpose and to assist us achieve some of the goals that we have set out to achieve as the government of Kenya in service to the people of Kenya. So asanteni sana. God bless you. Nawatakia heri na mkirudi nyumbani mtasalimia wazazi wenu. I know we have good people here who have been supporting St. John. I want to, in a very special way, thank your partners, Safaricom, and all the other good people here. Now that we have a piece of land, let us all work together to see how we can build it. Ndio. Tutasaidiana. The government of Kenya, apart from the land, is going to contribute some money, but we also want to work with others to make sure that we do that haraka haraka, ndio watu wa St. John waweze kupata mahali pazuri pa kuendesha kazi yao, ambayo ni kazi mzuri ambayo wanafanya kwa ajili ya watu wote ambao wako katika hali ya dharura or emergency. We want to work together. Thank you very much. God bless you.
Could we appreciate the Chief Patron another one more time? Thank you, Your Excellency.